So, patient with this and depression. So, any questions regarding this station?
No.
Okay, you have two versions of this station, either a lady who comes to you with resistant depression and symptoms of hypothyroidism, or a man who also having resistant depression and symptoms of hypothyroidism. In case of the lady, checks, of course, for the symptoms of the hypothyroidism, and what, if you are clever, what is the most important thing to ask in this case? If she
In the hypothyroidism?
Yeah. No, in the resistant depression. Okay, a lady who's presenting to you with resistant depression and you want to know more about what's going on, why she's not responding to medication. What is important when she tells you that there is also symptoms of disturbed menses and there is symptoms of hypothyroidism? What is a very important question which most of the candidates do not ask?
Compliance to medication?
No, pregnancy. Very important to ask her about the pregnancy, possibility if she's pregnant. Okay. Very important, don't forget this. Many of the candidates forget to ask about pregnancy in this case, and it is very important. I know that it is not written in your notes, but we want to say things which makes us different from the other candidates. And Claire, definitely a case of resistant depression if she's a lady in a childbearing period and there's disturbance in the menses. You want to know more about her family life, and whether she's getting support and her life is in stresses in her life, etc. And in case of the man who is having depression, we have this lady who might be pregnant, and we have a man who has a lot of stresses in his life, familial, financial, because he lost his job. So also this contributes to the resistance of the depression. Now, when you explain the diagnosis, do not volunteer saying that it is a resistant depression, because it did not fulfill the criteria of resistant depression yet. And again, this is another mistake. So we know that resistant depression is considered when he is not responding to two different medications. Now he is still did not fulfill this criteria. He is still in the phase of trying with him the second antidepressant. So when you explain to him the diagnosis, tell him that if there is no response to the current medication, there is a possibility that he might be suffering from resistant depression, and tell him what is the definition of the resistant depression and what is the consequence of this diagnosis, like adding a combination of treatment and more frequent follow-up, and the duration might be increased because of the resistance. Okay.
So I say he doesn't have it now, but he might.
When you explain, you are going to explain when you do formulation. You must explain that now he is still not. Because why do you say that he is resistant depression? On what basis? This is a mistake which all against. What is the base to say that this is resistant depression? He tried fluoxetine, did not work, and now he is still taking venlafaxine. You did not reach the maximum dose. You did not reach the duration, and now you are saying that he is resistant depression. Why? And this is a mistake. I know that this is not written in the notes, but pay attention to this, because the consultant is not, his reference is not your notes. The consultant, the radiologist is not obliged to follow up the SP, follow what is written in the SP. Okay, let's start. 1, 2, 3, go.
Hello, Mr. Smith. I'm Dr. Maram Muhammad. I'm one of the psychiatrists in here.
Hello.
I know that you're having some difficult time lately. Can we talk about that?
Well, yes, I feel that the medications are not working, and they told me that I must talk to you to see what can be the best next step.
Yeah, I can tell that this is frustrating for you.
Yeah, it is.
I know that you've been on fluoxetine, right?
Yeah.
And now you're on venlafaxine.
Yes, exactly, and I don't think that there is any improvement so far.
You don't think that there's any improvement? I'm wondering, are you taking the medication regularly?
Yeah, I'm taking the medication regularly. Yeah.
Okay. You're saying there's no improvement. Can I ask how have you been feeling now?
Well, I'm not feeling well. I feel that that there is any improvement.
Mm, mm, okay. How is your energy levels then?
Well, not that good. I don't feel that I'm able to do anything.
Oh, I'm sorry to hear about that. Do you have any thoughts during this difficult time to maybe end your life?
This thought comes to my mind, but I'm religious, man.
Mm-hmm. Mm-hmm. So your religion stops you from doing that?
Yeah.
Okay, that is. I'm wondering if you have any thoughts to maybe harm someone else.
No, no.
Okay, that's good to know. I know that this time, it's been difficult. You've been feeling sad most of the time. Have you ever had any time where you felt like you're happier than your usual? You have a lot of thoughts, a lot of energy.
No, no.
Okay, okay, that is good. I'm wondering how are you coping with this time?
Well, I don't know what to do, though. That's why I came here. I'm not able to cope.
Mm, mm. Because some people might cope with the street drugs or alcohol.
No, no, I don't say that.
Okay, okay, that is good to know. Do you have anyone to support you during this?
Oh, I have my wife and my family, but recently my family's condition is not good.
Oh, okay. I'm sorry to hear about that. What happened? There have been problems in your family. Okay.
Yes,
Do you have
yes.
any other problems right now?
A lot of problems, doctor. I work as a teacher, and they give me a very bad evaluation for no reason. I worked hard, so hard in my job, and everyone knows this. And instead of evaluating me, they give me a very bad evaluation. I'm being terminated from my job unlawfully, and this caused for me a lot of. I was so distressed, and it was financial problems and also
Mm.
familiar problems.
Oh, I'm so sorry to hear about this. I can tell that this has been a very difficult time for you. I just have a couple of questions to ask you before I can tell you how we can help you out. Is that okay?
Okay.
Have you recently noticed any weight gain?
Well, yeah, I don't know why, though I'm not eating well, but I gained maybe 5 kilograms in the past 2 weeks, for past 2 months.
Oh, okay, that is good to know. Do you have any physical health problems?
Like what?
Maybe like heart problems.
No, no.
Okay, okay, that is good to know. It seems to me, that you have depression and you have took fluoxetine and now you're taking venlafaxine and still there's not like you're not getting so much better, right? And you have also social problems in which there are problems at work, there are problems with your family and your finances. Is that right?
Yes, yes.
Yeah. It seems we also need to take care of your physical health and check if there are any other problems because some of the symptoms that you just talked about might suggest that you have some problems in your thyroid gland. So it's important for us to keep it in mind.
What is this thyroid gland problem?
Okay. So what we're gonna need to do is do some investigations and talk to your GP. Because sometimes when there's a problem in this gland in here, it can make you feel tired most of the time. It can make you, feel weight gain and feeling sad most of the time. So we
Okay.
need to make sure that there's no problem there first.
Well, doctor, do you feel that there is any hope, doctor?
We have a lot of options in here to help you out. If you would like to hear some of them.
Okay, yeah, sure.
Okay. So one of the things that we can do right now is actually increase the venlafaxine dose. I know right now you only take 150 milligrams. We can actually increase this to 325 milligrams. How do you feel about that?
Well, I'm okay with that, doctor.
Okay, good. So once we increase the dose, we're going to need to monitor your blood pressure and your pulse just to make sure that everything is okay.
Well,
Okay.
okay, doctor. Okay, okay.
Yeah. You know, if even if that doesn't work, we still have other options we can help you out with.
1 minute remaining.
We can augment the medication, give you another medication with the antidepressant that can help you out. Something like lithium.
Okay.
Okay, how do you feel about that?
Well, I'm okay if this can be helpful.
Okay, and even if that does not work out, we have other options in which we can add a talking therapy.
Okay.
Okay, something like cognitive behavioral therapy could be very helpful for you to help you deal with your emotions and your thoughts. I can give you more pamphlets about it. How do you feel about that?
Well, I'm okay with that, doctor, but I'm wondering still if there is no hope, doctor. Still there is no improvement. What can I do?
Okay. You know, there is something called electroconvulsive therapy that could be very, very helpful in your case. But this is our last resort. I can give you some pamphlets about it. And I would also like to check up on your work and your finances. So maybe you can help me with a social worker.
Excellent. Okay, good. Time.
Okay.
أخيراً فيها. طيب, how do you feel about what you did?
I
Okay,
did well.
so,
I think I did well.
okay, it was good. So I hope that you give her your feedback, doctor. I don't know, nobody investigations. We need to do some investigations. We'll look. Yeah. So let's see how it is. So first of all, when you start, we said that we start our discussion by gathering information about our main areas, the biopsychosocial, didn't we? This is how we start, because this will help us to understand what could be the reason for the non-response. So you should signpost. I would like to discuss with you what could be the possible reasons for this unfortunate non-response, Mr. Smith. Okay, and ask him about the physical condition and psychological and social. Now, so physically, please, doctor, you did not ask enough about the symptoms of hypothyroidism. You also only ask about the weight gain, and but just ask him about two other symptoms like cold intolerance and constipation, lethargy. Okay, very important, doctor. Okay, good that you have asking about other medications which might be taken in physical condition, but regarding the hypothyroidism, you came up with a diagnosis that he might be having hypothyroidism. You did not check enough the symptoms. Not because we all have weight gain, actually. So this does not mean that we all have hypothyroidism. So it's not enough.
Okay.
Okay, so if you feel that, yes, when you ask about thoughts of ending his life or just asking simple questions, so do you feel that sometimes you are not able to resist this thought? It is very important, because according to this question, you might be admitting it. Are you able to resist this thought, or you feel that this thought is totally dominating you? A very good question, but it was not enough. One sugar, okay, good, but not enough. Because yes, he might be having thoughts of harming himself, but so what?
Okay.
But if he is totally dominated by this thought and feels that he cannot resist it, this means that he needs to be admitted. I have this patient and asking this particular question, I did not admit. I told you I have familiar problems, and then you paused. I expected from you to tell me.
No, I asked. I think you didn't hear me. I asked what happened.
Oh,
but you
okay.
didn't answer. So I thought,
I didn't
you don't want to talk about it. So
no, I didn't. Maybe I did not hear. So do you have any physical? Yes. When you ask about we have three areas here: biopsychosocial and level of risk. Start by an open-ended question, because when you started asking about the physical health, you asked me about the symptoms of weight gain, and then asked me the open-ended question. So do you have any physical health problem? No, you stop by the open-ended question when you assess the physical health. So you are stopped by the question if he has any physical health problems, and ask him about the symptoms of hypothyroidism, and if he has any very important to ask him if he has any post-medical history other than this, okay? And if he is taking any medications. And substance misuse, very important to put I put the substance misuse with the biological or the physical assessment.
Okay.
I don't know, still they do not put any excellent communication skills. Someone here is one of your fans. No, we don't want blood tests. Yes, they did not. I will just read our colleagues' feedback. He did not talk about investigations. Two of the candidates are paying attention to this. Your communications was good, but it needs some just fine refining. Okay, so let's continue. Do you have any physical hormone data? But hormone, yeah. How do you explain when I ask you what is this thyroid? I found that you don't have a really simple explanation.
Yeah.
Simply say that thyroid is a hormone which is released from a gland in the front of the neck. It is closely related to the mood problems, and it's also responsible for the energy consumption in the body. Okay. Simple as this, energy consumption. That's why it is closely related to weight gain and weight loss, and also closely related to the symptoms, to the mood symptoms. Lithium, again, now you did not talk about resistant depression. Did you say resistant depression and explain the possibility that if venlafaxine did not show improvement, then this patient can be considered as having resistant depression, and this means that we might need combination of medications. The duration of treatment might be increased and the intensity of the treatment might be needed. And this should be documented because resistant depression can escalate to severe depression. Okay, very important to say this. Okay. So why do we say that it is resistant depression? Because it might escalate to severe depression because there is no response to the treatment, and this might have risk and complications. And this also indicates that this patient might need intensive treatment, whether psychological or pharmacological. Okay. When I said that, look, doctor, when you talk about the formulation, we don't do the formulation for the sake of saying formulation. The formulation means that you are mentioning the points which you are going to focus on in your management plan. So I said to you that I have family problems, and you know, the financial issues cause problems with his wife, and so you can say that we can have sort of family therapy. Very important. You said in your formulation that there are some familiar stresses. Okay, good that you mentioned that you might need social services because the treatment here might have a long time, and this might affect his job. He might need some sort of support. You don't know. So this might be organized by the social services. If anyone has any question regarding this station, please write it down. Doctor, exit 2 and exit 3. Well, now, doctor, I don't know what is this name, but I don't now know work by exes. This is very old now. Well, I still like this, but now nobody will understand what you're talking about. Okay. Okay, so let's see the mark sheet, doctor, rapidly. Okay. No, so I want you to formulate the problem. And I hope that everyone in a piece of paper tries to formulate, because this might be our last management Zoom session. And it's very important that everyone understand how to formulate. Now, I want you to formulate rapidly, doctor. How would you formulate this patient's condition?
You have depression, and you took a full dose of fluoxetine, didn't work out, and now you're on venlafaxine. You also have some social problems with your family and your finances and your work, and we need to check up on your physical health because you might have some problems there.
Good, and there is a possibility that you might have resistant depression. You must say it because this is something which you are going
Okay.
to do. Very good. Now, I felt that you wanted to formulate, so this might be scored or not scored. You did not say what you said exactly. You recognize the significance of finding a result. Your management plan, you said that you are going to increase the dose. Unfortunately, you did not mention the investigations. Why didn't you mention the investigations? This patient, you said that he might be having hypothyroidism. So because you lost
I did say that we'll liaise with the GP and we'll
no. When you talk about investigations, this is not something to be generally understood by the patient. No, you must make it clear what are the investigations which you are going to focus on. Okay, so you must focus on the investigations related to his thyroid hormone level and also the general investigation, liver functions, kidney function. Okay, does not pay sufficient attention to the patient health. You mentioned this. Does not develop adequate risk management plan. You asked me about the level of risk, but I hope that when you talk about in this particular stage, when you talk about the management, you must mention that a risk assessment will be an ongoing process, and at any time you might feel that it is unsafe for you to be treated at home, the admission might be considered. Please mention this, okay? Because this man has told you already that I have death wishes. Psychological, you mentioned it, and intervention, social intervention. So I think in the management, you might lose 1 or 2, maximum 2. Okay, it was organized, not formalic. Your attitude was good. Your communication, everything was good. Again, doctors, this is not. I'm not an examiner, not someone to tell you who is going to pass or fail, but just to make you understand the mark sheet which you are going to be assessed with. And this is what helped me to pass, because I was focused on the mark sheet. All what I was doing in the station when I go, my mind was oriented around the mark sheet. Okay, thank you so much, doctor. Very clever, very clever.
Thank you.
Okay, who would like to go next?
My station, second one.
Well, we have a list here. I think who said that? Doctor.
I'm here. I'm the second on the list.
Dr. Nanam?
Yes, Nam.
Nam. Sorry, sorry, Dr. Santosh. Dr. Nanam said that he is going to the station after Madam. How are you, doctor? So, what is your station, doctor?
It's pediatric overdose management and childhood sexual abuse.
Yes, the station which you are talking to the nurse. You are talking to the nurse in this station.
Yes, I'm speaking to the nurse.
Now, this station comes in the real cask. In the real cask, you will go in this station. Please mute your mics, doctors, please. In the real cask, when you are in this station, this girl will handle you a small piece of paper written in it. Sorry, I muted Manam. Please mute your mics, doctors. Written in this station that either that the aliens want to impregnate her, or that her stepfather abused her. Okay, so this is what you are going to get in the real case. And in but when you are going to talk with the nurse in the management station, the nurse is not going to be happy with her presence. This station was one of the stations which was old format, that you meet the girl in the first part A, and part B you meet the nurse. Now you are going to meet the nurse. You have 2 scenarios will be written in the A4 paper at the door of the station. That this girl has her mother admitted in the hospital, and she started to have psychosis, maybe 2 months ago, and she believes that the aliens want to impregnate her, and that's why she is not going to the school, and she will handle the paper to you saying this. And that's why she wanted to kill herself. Okay? And in the management station, you are going to talk with a nurse who is not happy with this, the presence of this girl, because she is in the medical ward while they are, she is totally psychotic patient. They don't want her in your.
Sorry to interrupt you, Dr. Hussam. In the station I was giving, the story is a little bit different because this child has been sexually assaulted by the father.
Stepfather. Yeah.
The stepfather.
Yeah. Yes, there are 2 scenarios in this station, the same station. Either that this girl is assaulted by a stepfather, or she is having psychosis and thinks that she is impregnated by aliens. And she is now in the medical ward and the nurse is not happy. So what you have read is this one of the 2 scenarios, because you might get the same station with different scenarios, so don't get perplexed. Okay, this is one of the alterations which happen in the scenarios which the Royal College do. Do you understand what I'm saying? I'm telling you this to be ready that sometimes it is not a copy paste. Sometimes what you read in the SPM notes might be a bit different from what you get in the real cast. So the other story goes that this girl is totally psychotic and she believes that the aliens want to impregnate her. Okay, so as I always say to you doctors, this exam is primarily about your communication skills. So now you have a nurse who is not happy with the presence of this girl in his ward. How are you going to handle this situation? This is your primary job in this task. And then you are going to discuss with him the management. But if you ignore that this man is not happy with the presence of this girl, he will be very defensive and he will not hear what you are saying, and you're going to lose the station. Okay? So the first thing which you should do, try to understand why he is not happy with the presence of the girl and what are the difficulties which he's having, and make sure that please doctors mute your mics, doctor, except Dr. Nana. Okay, so doctor, so make sure that you address the feeling of the nurse and take a handover from him. Okay, 1, 2, 3, go.
Hello.
Hello, doctor.
My name is Dr. Anyim. I'm one of the doctors of the mental health team.
Hello, doctor.
How may I address you?
You can call me Mike.
Hello, Mike. I understand that you wanted to speak to me about one of your patients, Sarah.
Yeah. Sarah now, she took some tablets of paracetamol. She is medically cleared, and she's talking about total nonsense. I think she's totally psychotic, and she is medically cleared. You please take her back to your ward, please, psychiatric ward.
Okay. I can see that you want us to take over caring for Sarah. Is it all right if I just ask what's been happening since she come into hospital?
No, she has been admitted because she took, I think, 50 tablets of paracetamol. Okay. And now she is medically cleared. She doesn't have any medical problems. And I think she should be transferred to your side, please. Because I feel that she is not okay. She wants to go out and move over. So her stepfather says that he wants to see her. And I don't know if this is feasible, because I heard that she told one of the doctors that her stepfather is abusing her. And actually, doctor, I don't feel that she has anything. She wants to be with her mother, who is also admitted in psychiatry.
Okay, I understand your concerns about her. And I'm just wondering, I've also seen Sarah myself, and I'm happy to go through with you my findings from speaking to her, and then we can think about what we can do for her. All right.
Well, doctor, doctor, real doctor, this discussion will not go anywhere because this is not our specialty. We have done our job as medical part. She should go back to your side. If you want to continue taking care of her, please do this in your side. We have a very busy ward, and really, there is no place for any psychiatric patients here.
I do understand how busy things are on your ward and your concerns for us to take over to our ward. However, there are quite also a few concerns that I would like to share with you from my assessment and why it might be more appropriate for her to continue to remain on your ward for now.
Okay, no problem.
Okay, so just to, from my assessment from Sarah, I've seen her, and like you said, she's taking a planned medication overdose with intention to end her life. And this is following that she's made allegations that her stepfather had raped her a few days ago. And this appears to be something that has also happened in the past. He tried to sexually molest her. And I believe that there's an ongoing risk that this could happen again if we were to maybe send her home from hospital. And also talking about taking her over to the mental health side. Sadly, we don't have any bed capacity at this time to admit her to the mental health ward. And also, she may still need to receive some further care from the medical team and other investigation. Are you following me so far?
Yeah, doc. Yes. Yeah, but doctor, well, she's totally psychotic and she wants to end her life, and we are not prepared for this type of patients. We are not specialized in handling this type of patients, though.
Yeah, I can understand your concerns with respect to that. I agree with in terms of her mental health and the way she's presenting in her mental health could be quite related to what has happened to her. So what we can do is to work together as a multidisciplinary team to support you. So while the physical health side of things being handled on your ward, we also come in as the mental health team to support her and come to assess her daily on your ward.
Well, doctor, so what could be the best route now of action if you're not going to take her from here?
So what we need to do, like I said, is to manage her in conjunction with the multidisciplinary team from our own side, which will involve talking to the mental health team. We will think about maybe starting her medication to help her, and she may also, when she's more stable in her mental health, we may need to give her some psychological therapy, talking therapy, and also we may need to involve the social services to assess the situation at home and to see how best we can support her.
But her stepfather doctor wants to meet her doctor, and I don't know what could be the best course of action.
Well, right now, I would not think that would be appropriate because of the allegations that has been made against her stepfather. So I would think it would not be wise for her to meet with the stepfather as at this time. I would like to also speak to the children safeguarding consultant about what has happened to get some advice. And we might need to report the allegations.
1 minute remaining.
Might need to report the allegation she has made to the police, who may need to investigate further what has happened. So in that situation, I don't think it will be appropriate for her father to see her stepfather to see her at this time.
Okay, though.
I don't know if I've addressed all your concerns, or you still have any question you would like to ask me.
No, thank you. Thank you.
Okay, so we will be attending to review Sarah regularly while she's on the ward and support her with her mental health.
Okay, time. How do you feel about what you did?
Well, I'm not sure. I don't know. I think
Okay, so the first thing in this station, as I told you, is to address the dilemma or this situation which the nurse is trying to raise. So he's not happy with the presence of this patient. He's not specialized in this situation. There are concerns about her safety. Her stepfather wants to see her, and she wants to end her life, and well, many things. So the first thing you should ask him. So understand that the presence of Sarah is not that easy, and I have very difficult word, a busy word. I'm wondering what are the difficulties that you are having because of her presence. Let him speak. Tell me more. Well, and rest assured that I will. And when you try to manage this, you tell him that I will sit with the nursing staff to explain more about how to take care of her, and I will send a nurse who specializes in taking care of this type of patients until there is an available bed in outside. Very important to say this, that a nurse from your side is going to take care of the patient at their side, because it is not their job. They don't know how to deal with these patients. Number two, a mental health act must be applied. You did not mention it. Very important to say that the mental health act must be applied. Now, regarding this situation, there is definitely some sort of forensic assessment. So you must say that we must incorporate our forensic psychiatrists in this type of situation to know what is their opinion. Regarding the stepfather, we can have a social services support in order to address this, because he cannot contact the patient while there are such allegations against him. And at the same time, we cannot make sure that this man is the culprit. So you can shall safeguard. Yeah, what is this side? Shall safeguard. Okay. Well, forensic and social services, these are this is the job of the forensic and the social services, to inform the police to take action. Okay. So you must inform the social services and the forensic side to assess the patient and take the legal actions. Okay. So let us see. Did you formulate? You did not formulate. I don't know why didn't. Need for medical investigations, child safeguard. There is need to pay attention to the child's safety and involve the child's mother. The child's mother cannot be involved because she is in the hospital. She is admitted. This is a very important question. Actually, you are going to be asked if the mother can be informed about this. If they can tell the mother that her child, her daughter, is also admitted, while the mother is also in the psychiatric hospital. Simply, you can say that this is something to be discussed with the PT team to see if her condition is suitable to tell her this. Okay, so let us see according to our slides, what did we do? No, you had a good introduction. I hope that you just paid attention to what the nurse is saying. And I feel in this station, you might lose the station because you did not pay attention to the problem which is facing. Tell me more, what are the difficulties you are having because of her presence in the ward? Okay, and then explain to him that you totally understand what he is saying, and you address his concerns, and you will have a meeting with the nursing staff to see how you can take care of her until there is an available bed. We must say this. Gathering relevant information now. We already know that. Okay. Please, doctors, mute your mics, please. Okay, so where we yes, you in this station there is no enough, you already have that she is medically cleared. You ask him about the level of risk and what information he knows so far about her and what is the management done. Because when you take information from a nurse, they expect from you to know how to do a handover, and you must say it clearly. I would like to take a handover from you about this patient. You must say it clearly because this is how we speak with our colleagues. So what are the management steps done so far? Any concerns about her risk? Any information about her family? Can you tell me more about her attitude and behavior? So we are gathering information about her psychological, social, and level of risk and the management done so far. This is how you speak to a nurse. They bring a nurse for a reason, though. You must say clearly that I'm going to take a handover. How do you take a handover? You gather information, the biopsychosocial areas and the level of risk, and ask him about the management steps done so far. If you don't do this, you are missing the discussion with someone who has been already in the management of the patient and he has important information. Okay, you didn't ask.
Sorry, Dr. Sam, I just want to ask you, in this station, it's the scenario is presented as that you as a doctor have already seen the patient. So you've assessed the patient and you're to speak to the nurse and you're giving like lots of information about what's happening to the patient and the risk and all that. You need to ask the nurse to give it all over to you again.
Yes, because you have seen the patient, but now he is in a medical ward and he is the one who delivered the service. And he might have an information which you don't know, okay? You have seen the patient, but you don't know what did she do in the ward.
Okay, that's
You
fine.
understand what I'm saying?
Yeah.
Okay, and after assessing the biopsychosocial domains and the risk, now there is no here particular diagnosis, but there is some sort of formulation that this girl has. Can you formulate now according to what we have done so far?
So what I did in the formulation, you said I didn't formulate, but I think I did in the station.
Okay, please formulate what is the, so how.
Said that this girl had taken a planned overdose of medication and then with an intention to end her life. And this was following and making allegations of being raped by her stepfather. I said also that there is ongoing risk of this possibly happening again.
Good.
Because I said in terms of her mental state, she's quite traumatized from this experience. And she's feeling low in mood and miserable and having flashbacks of the experience. And there's no support for her at home because her mom is in hospital and her dad has a background of alcohol problems.
Very good, very good. So did you this? Well, it is very difficult to pay attention to do the role player. And did you say this exactly what you said?
Well, I didn't say all of it, but I certainly said the situation.
No, you must say, actually, when you formulate, please formulate accurately. And you must signpost. For example, you can say, so before going through how we can help the girl, Mr. X, I would like to highlight the most important points in her condition. Don't make it a salad in the middle of the words that I did in the middle of the discussion that I mentioned the formulation. Just make it clear that I'm going to highlight the most important points of her condition and mention what you have just said. Always, and you must mention that she has positive family history of psychiatric disorder in her mother. Okay, so
yeah.
The main psychological problem that she is traumatized, the allegations against her stepfather. There's high risk of suicide because she has attempted a serious suicidal attempt. All this in the background that she is medically cleared. There is positive families of psychiatric disorder. We need to know more about her social level of social support, the child guard, and if there is any other children at home, and the family situation. All this is important in the formulation because all this should be addressed in your management plan. Every point you are going to mention the formulation, you should sort out in your management plan. Okay, so the management plan after the formulation. first thing you should talk about what are you going to do. You did not say what are you going to do. You must say that I'm going to follow her up regularly and I give you my contact number. You're not just going to leave her there. So, well, what are you going to? You must say that I'm going to see, and once there is an available, but definitely I'm going to transfer. What are you going to do when you see her? Thorough risk assessment, evaluate her physical, assess her physical and mental condition, okay? And also explain to her her illness and the management plan. Not because she's a child, you should ignore this. Why I'm saying this? Not because you will be a cool doctor, but there is a particular point for the doctors who explain their management plan to their patients. We will see it in the mark sheet. Where the patient is going to be treated, you mentioned this. The investigations, did you mention the investigations? That we are going to start a medication. Doctors never start a medication without mentioning the investigations. This is the rule of thumb, okay? And the multidisciplinary team, you mentioned the psychologists, you mentioned the role of medication, but you did not mention what type of antidepressants or medications that you might need to use. What type of medications?
I will give an antidepressant in this case.
Yes, what type? She is a child.
Oh, fluoxetine.
Yes, and if she is agitated, you must mention that we might need to use a lorazepam to calm her down, small dose of benzodiazepine to calm her down. There is no psychosis so far, so the backbone will be the psychotherapy, fluoxetine and lorazepam to calm her down. Regarding the non-pharmacological, you must mention the social services, the forensic assessment, and that's it. Very important to say this. Okay.
Yeah.
Let's see what is the feedback of our colleagues. Yeah, he's very confident, doctor. Very confident. Giving contact. Why mental health act? If she was doctor, she tried to. She's not. Yes, she is at the hospital, but if she wants to leave, you might need to consider the mental health. Yeah. Okay, so let's see the mark sheet rapidly. Okay, so why do I say you must signpost and show that you have formulated? Because the first point which you are going to be assessed for is your ability to formulate. This is the first point. You recognize the significance of findings and results, that she is there is risk, she has an overdose, she needs to be admitted. You add, unfortunately, the management plan, you did not mention the name of the medication and you did not mention the investigations. And you did not say that I'm going to talk with the patient myself, explain the management plan. Well, saying the outlines is not enough, doctor. Okay, so I'm afraid that point 3 and 4 might not be scored for you. The risk management plan you did address, psychological and social you did, though I hope that in the social, the non-pharmacological, you mentioned that the forensic assessment of her is very important. It was organized. It was not formalic. Your attitude was good. Your listening skill was good. Everything in your communication was good. Okay. Again, it's not a pass or fail. Just help everyone to understand how to approach the situation. Thank you so much, doctor. Very clever. Very clever. I hope that you found it helpful.
Thank you very much.
Okay. We hope, doctor. I think we had Dr. Santosh. I know that you want to do your station. We had some sort of a list in which there is Dr. Anas after Dr. Nam. The list was done very, very early, maybe before at 5 p.m. So
mine was second station.
Where is Dr. Anas?
Hello.
Well, we have a list. I have to revisit this list again.
Yeah, the second station was allotted to me, morbid jealousy.
No, Dr. Santos, I think, yes, morbid jealousy, but we are not going through the list, the sequence, 1, 2, according to the sequence in the stations in the list, because sometimes the candidates are not available. In
No
the
issues.
station and so on. So we have a list which we start with in the chat section, who is available, and maybe your turn will be after Dr. Anas. So,
Thank you.
Dr. Anas, please, what is your station?
Panic disorder.
Excuse me?
Panic disorder.
Panic disorder.
Panic.
Can you panic?
Yes.
Can you just raise your voice, please, doctor?
Okay. Now you hear me well?
Yeah. Panic disorder. Okay. Okay. So, are you ready?
Can start.
Yeah.
I'm talking to the patient or mother.
Let's say that I'm the husband of the patient. Let's say that I'm the husband.
You patient?
I am the husband of the patient.
Husband. Okay.
Yeah.
Okay.
Okay. 1, 2, 3. Go.
Hello, my name is Dr. Anas. I am one of psychiatrists in mental health. How can I address you?
You can call me Mr. White.
Mr. White. So, Mr. White, I understand the cardiologist referred your wife to me. Your wife name, sorry?
She's Mrs. White.
Mrs. White. Okay, so could you tell me more about that?
Well, she cannot go out of the house, Doctor. Whenever she goes out, she feels that she's going to die, and we go to the ER. And every time we go to the ER, they say that there's nothing going on.
Well, I'm sorry to hear that. So when did this start?
We started maybe 1 year ago.
1 year. And do you remember first times symptoms happening to her?
Well, in the beginning, she was a bit, not comfortable, and she said that I feel that there's something wrong, and we went to the hospital. But with time, it was escalated, though.
Does she complain? Did she complain from other symptoms about dry mouth or anything, or only
No,
heart
no,
problem?
no. She just
Okay,
always said that she
so
feels that she's about to die, and so.
about to die. And how long this episode stay like last? How this episode? How long
Well,
this
with
episode
time,
last?
it lasts maybe not more than 20 minutes, but during these 20 minutes, she feels horrible.
Oh, I am sorry to hear that. So this happening how many frequent this happening?
Now
If we
it is
say
happening maybe once or twice a week.
once or twice a week. So starting from 1 year, then until now it's happening twice per week. And you visit cardiologist, and he did investigation to you and told you that everything is normal, right?
Yeah.
Okay, so could you tell me how this affect her life? Is it able to work and take care
No,
of?
she is not able to do anything, doctor.
Is she not able to work or take care of home?
No. She's not able. She's working as a teacher. She stopped going to the school. All the education school year, she did not go to her work because she had this attack twice in the school, and she decided that she's not going to go anymore.
Oh, I see. It's a difficult situation. So, did she try to use anything like alcohol or any substance?
No.
From your thing, did she had any problem with sleep or appetite?
No, 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 no.
Or did she told you that he think about to not to carry on or to harm herself or suicide?
No, no, no.
Well, thank you, Mr. White, for sharing this information. And I wanted to tell you that what she has now, she has something well known as panic disorder. Did you hear about that?
No, what is this panic disorder?
Actually, panic disorder is type of an anxiety disorder, but it comes as attacks by physical symptoms, like physical symptoms and the thoughts about that going to die, as you mentioned, that and the loss of control. They think that it's going to die, but that not related to any heart problem or any medical cause. So that does make sense?
Yes, yes, yes.
Okay, and do you have any question so far about
No,
that?
I'm just wondering, so what can be the best route now in order to help?
Actually, we need to treat her by a team, starting from we need to contact again with the GP to review investigation. She did only she only consulted with cardiologist, but she need to more investigation about thyroid problems, maybe excess of thyroid hormone related to this condition, and other investigation, adrenal and blood glucose level. So adrenal hormone and the blood glucose level. So if we confirm that everything fine, we can go forward for psychologist. And first, before psychologist, we need to talk with her to explain to her about her condition. Then I think a psychologist will
one minute remaining.
Okay. Okay, sir. So psychologists they have a specific therapy for this panic disorder. It focus about how to deal with stress by relaxation technique and breathing exercise. So we don't have so much time. Last thing regarding the medication, if this psychological therapy failed, we can give for an anxiety medication type of SSRI. It's called fluoxetine. So actually, thank you for visiting me, and we don't have so much time today. We can give you leaflet about the panic disorder to understand more about the disorder, and I will see you again.
Okay, thank you.
Thank you.
Time. How do you feel about what you did?
Yeah, I don't know. Sometimes I lost track, but sometimes.
Okay, so you must, Dr. Anas, you must have a clear plan in your mind to address the mark sheet of the Managemnt stations, which is different from the mark sheet of history taking, because for 4 minutes you have been taking history, we're not doing management. And I wrote it down. You started your task after 4 minutes. You kept asking information about her illness, which are totally history. Okay.
Mm-hmm.
You can just sometimes, doctor, sometimes in the A sheet, the big sheet where they give you all the information that you don't need to ask more about. You don't need to gather information. So if this is the case, just start by asking if he has what does he understand about her condition, and if he has any concerns about her safety, and then explain the diagnosis. Because sometimes, like in this case, if you have read the SPMM notes,
Yeah.
and I mentioned and in the particular page which I have sent, everything is given to you. In this case, there is no place to repeatedly ask these questions, and this will help you.
That's
actually.
yes, that's my question. Can I use this in written in task? I was wondering, should I use the information that already mentioned, or I have to ask about
No,
this
you can.
information?
This information is already mentioned to you in order to use them. So when you are going to do formulation, use this information according to because you have seen the patient. Okay, but what is the benefit of this information? It will save time. So you don't need to go again to biopsychosocial domains, but only ask him about what does he understand so far about the condition of his wife, and any concerns about her safety, and then go through the explanation of the diagnosis. Now I wanted to, how do you explain the panic disorder? What is the, how do you
This
explain,
type
what is,
of anxiety disorder. That is a type of anxiety disorder that presenting by attacks of physical symptoms like palpitation and sweating and dry mouth.
yes, continue, that's it.
And it is not related to any organic cause.
Okay, let's write down this explanation I used in my class, and I thought, okay, I hope that you write it down. Now, the panic disorder is a psychological disorder in which the patient starts to feel that there is an apprehension or a danger is going to happen to him. And this is because we all have a particular psychological program which is activated whenever we are facing dangerous situation, which makes us either fight or flight. For unknown reasons, this program is activated in the patients who have panic disorder. So they start to feel as if there is an apprehension or a dangerous situation is happening, and they start to have rapid heart rate, rapid breathing. They start to feel anxious and fearful. And they explain this by having serious medical disorder. You will not find this explanation anywhere else. Did what I said make sense for you? Okay. And obviously there won't be any underlying medical disorder whenever they do any further medical evaluation. Okay, write it down. It must be simple, it must be accurate, okay? Because I didn't feel that you explained it in a very good way. Okay, and then he's going to ask you, so what could be the possible reasons for this? You must be ready with our cliché that there is no particular reason, but there are causes which increase the possibility of having this disorder, like chemical imbalance, past psychiatric history, family history. Okay, there can be underlying medical problems like thyroid. However, we have excluded this problem. Okay, that can be, but in case of your wife, there is no underlying medical.
Okay. Then
Okay. Let's see the Walker for the history. Okay, so please formulate. I want you, please, and everyone try to formulate.
I forget. I was ready to formulate, but so Mr. White, to recap what we talk, she has panic disorder, and she don't use alcohol or any other substance. and that affect her social life and work, affect her work and social life.
Okay. We're going to share our slides now, please. Okay, so let's see. Well, the best formation now, we can say that according to our assessment, Mrs. White is having a panic disorder, and there is low level of risk on her life. However, there is some sort of effect on her financial and familial life because she's not able to go out of her house. All this on the background that she does not have any medical disorder and there is no underlying psychological past history. That's it, simple as this. Make sure that you formulate, doctor. Okay, so how do we do this station now? Already many information are given to you in the A4 sheet or candidate's notes. So when you start the station, ask him, what do you know so far about her condition? And only ask her about the risk because there is a particular point for those candidates who pay attention to the risk. And then you explain the diagnosis, as we have mentioned, and then you do the formulation and then talk about the management plan. What are you going to do, Dr. And it's very important to say that I'm going to see her myself, assess again her mental condition. She's already been assessed physically, and explain to her the management plan. Very important to say that I'm going to explain the management plan to the patient. Where she is going to be treated is very important because as the story goes, this lady has a problem in going out of her house. So that can be a sort of helping to her extensively at her home until she is able to go out to take the talking therapy at the hospital or wherever the psychologist is going to arrange it. He did not mention the investigations. You mentioned, well, weirdly, you mentioned thyroid, you mentioned blood sugar level, but you did not mention the heart and liver functions and kidney functions, which are the basic information which you should know. And the blood
as she already, sorry, doctor, if he mentioned already that cardiologist did investigation and was normal, so should I again ask about we know do it again?
You just mentioned I'm going to check her blood investigations, particularly check if it is mentioned. Just I will check these investigations. Don't say that I'll check the blood sugar level, the etc. liver function. Okay, but you must mention this. Multidisciplinary team. Now there is already has been assessed by the physical by the GP. The backbone here is the CBT. Now the CBT you must explain it. Okay, you must explain the CBT to this man and be ready with an explanation. And you must mention the general outline of the CBT, 12 sessions once every week, and there will be homework in between the sessions. Okay, and you will help her with medications. In the beginning, definitely she will need a course of short-acting, short course of benzodiazepine. It is very important to mention. Most probably she will need this. Okay, and then it will be stopped gradually because of the potential of abuse. And the backbone will be the CBT together with the antidepressants, SSRIs. The non-pharmacological approach will be the social approach if there is a need for the social services, because you want to make sure that the duration of the treatment is not going to affect her job. This is something which should be arranged by the social service. Let's see the feedback of our colleagues, and please pay attention to their feedback. Why do we need to ask about other anxiety disorders? Yeah, this is very good, Vijay. We don't need to ask. This is management.
Yeah, yes, Dr. Hassam, because the task is clearly about panic disorder management.
Yeah,
and we start taking, we'll be losing much time. So that is my opinion.
Exactly. So we need to ask about why Isil and Suravi and Dr. Patra don't ask questions regarding the history taking. Focus on your task. And really, I thank you for this mistake which you are doing now, because it is very common. The kind of thing that they go and do what they think they should do with the patient, and they forget there is a particular task, a particular mark sheet, and a particular outline of what you should do. Now, what you are going to do now is that you are going to waste time regarding the day, and you will focus on the day. Okay. Why do you check here what 24 heart cardiac monitor? She doesn't have any heart problems. Don't ever say this, Dr. Isil. I don't know, maybe actually, I hope that I'm saying the name correct. Okay. Okay, so let's see the worksheet rapidly. Okay, so I think you can formulate in a better way. You did recognize the significance of findings and results. Your management could have been better. You said that. Did you say that I'm going to talk to her to myself and explain
Yes.
everything? Okay, so this is going to be scored for you. Did you talk about the risk? And that I'm going to do thorough risk assessment. If you do not mention this point is not going to be scored for you. Even if someone knows why this is the panic disorder, why there is no. Don't argue with me. There is a particular point in the mark sheet for the candidates who pay attention to the risk. So no need for the argument. This is something which the diagnosis is not. So if you did not say that I'm going to do thorough risk assessment, and we will, if you don't say this, most probably this is not going to be scored. The psychological, you mentioned the CBT.
Sorry, I have to ask about risk, or at the treatment I talk about risk.
Two of them. You ask any concerns about her safety, and when you mention the management, you must say that I'm going to see her myself and do thorough risk assessment, and this risk assessment is done regularly to make sure that she is safe. Why do we do this? Because there is a point about for those who pay attention to the risk.
Yes.
Or not for those who mention risk casually. Okay. But adequate risk management plan. Now it was not very organized, and I felt that your management could have been better. For 4 minutes you did not start the task. Sometimes you mentioned jargon. I think your language could have been better, and well, I feel some candidates their language is English is not our all, is not our primary language. So some candidates need to focus more on the questioning style and language, and this is not something difficult. Just write the sentences which you are going to use. Make sure that they are accurate grammatically. And the good thing is that you will find that these sentences are going to be used in most of the stations, not only one station. Okay, there's no time here to have English courses. Thank you so much, Doctor. I hope that you found it helpful. Okay. Okay, how are you, Dr. Sanders? So what is your station?
Good, thank you. This is morbid jealousy.
Morbid jealousy, yep.
Yeah.
So in this station, this lady is going to insist that he must come back with her, though there is an obvious risk on her, and there is an obvious past history of assault from his side to his girlfriend, but she still will insist that he must go back with her. Please do not ignore this and tell her. So I feel that there is high risk still. You are insisting that he goes back at home. If there's any particular reason which you would like to discuss with me, and you'll find that this man is the only sponsor or money source of money, and there's some sort of bills and rents and so on. Okay, and you must address this issue in the management plan. Okay, let's start. 1, 2, 3, go.
Hello, I'm Dr. Kumar, one of the psychiatrists from mental health team. How shall I address you?
You can call me Mrs. Brown.
So, Mrs. Brown, I came to know that you have brought Mr. Brown as he was agitated today morning. So can you please, I'd like to know your understanding about him. How is he doing?
Well, doctor, just he's a bit jealous. It's just
Mhm.
one misunderstanding, and I
Mhm.
feel now that everything can be sorted out at home now, and I hope that
Mhm.
you can allow him to go back.
Right. You said that he is feeling jealous. Can you tell me more?
Well, he's saying nonsense that there is something going on between me and the neighbor, and this is not true, doctor. He is, and when I ask him why do you say this, he's talking, some things which are totally illogic, doctor. I understand that this is jealousy, and when we go back home, everything will be okay.
Yeah, I'm really sorry to know that you are in such a situation, and it must be difficult for you. So I like to know that because of this jealousy, has he ever tried to threaten you or harm you?
Well, this is what happened today, and I was very intimidated. But this is the first time to happen, and I'm sure
Mhm.
this will not happen again. And I hope that
Mhm.
you understand that he must go back home with me, please.
Right. So can you please tell me what happened actually?
Well, he tried just to. He was threatening me and shouting, and I found he went in the bedroom. He was stabbing the pillow with a knife, and I felt that there is something wrong, and I hope that we can sort it out here. That's why we came here.
So did he hurt you or himself?
No, no.
Has he expressed any views to hurt the neighbor?
Well, he said that he might
Right.
talk with
Okay.
him, but I don't know what does he mean by.
Yeah. I hope that you must be aware that a similar incident has occurred 4 years back, in which he tried to stab his previous partner, and he was admitted at that point of time, and he was started on one of the medications called risperidone 2 milligram.
Well, definitely this is something which is totally different. This happened
Okay.
4 years ago, and I hope that you allow him to go back, and we can come to your clinic regularly.
Okay. So I can see that you're very keen to take him back to the home, despite knowing that there might be some risk associated with it. Can you please tell me why are you so keen to
Well, doctor,
take him back?
he is the only source of money, and there are a lot of bills, and there is rent to be
Mhm.
paid, and staying at home without him, doctor, will increase the possibility that he might get evicted. So I
Mm.
think he must come back home, doctor.
Okay. Okay, I can understand that it's a difficult time for you. So I was discussing about the medications that he was taking. Is he currently taking the medications?
No, 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 he's not taking any medication.
Okay. And does he take alcohol
Occasionally he takes smokes and cannabis.
or any other substances like
No,
cannabis?
no,
Right. Okay. Does he have any long-term physical illness which I should be knowing of?
no, no, no.
Right. So, Mrs. Brown, just to recap things, it seems to me that Mr. Brown was brought to you today morning as he was quite agitated. And he has been, for me, it appears that he is suffering from something called morbid jealousy. And morbid jealousy is a condition where someone has a fixated belief that the partner is being unfaithful to him, and he is not ready to hear anything else other than this. And he's posing serious threat to himself, sorry, to you, and also to the neighbor. And so we will like to keep him in the hospital, and we'll like to help him out in best possible manner. Will that be fine with you?
Doctors said all the being in the hospital will increase will cause problems at home.
Yeah, I can understand that since he's the lone breadwinner for the for you and the for himself. So what we'll do is we'll take this multidisciplinary approach where the social services will also come to help you, and the multidisciplinary team from this hospital will treat him with tablets, talking therapy, and also social support to you. In fact, we can help you arrange alternative accommodation if you wish at this point of time.
Well, doctor, so I'm wondering, so come and visit him.
In fact, since he is posing serious threat to himself, to you and to the neighbor, so it won't be wise at this point of time to visit him and to stay with him. It will be very prudent that you stay away from him physically at this point of time. Yeah,
Okay.
and I like to see him personally. Will like to examine him. I'll like to do the physical examination of him, do a thorough risk assessment, and will explain him the management plan that we have for him. And will also like to know his views about the management plan that we have for him. Will that be fine with you?
Well, I'm okay with that, but I'm sure that he will not accept doctor to stay in the hospital.
Right. In that case, we'll have to use a specific section of Mental Health Act, and we'll have to keep him in the hospital for
1 minute
ensuring your
remaining.
safety and safety of the neighbor. And we'll be doing some blood investigations, routine blood investigations like complete blood count, renal function, kidney function test, heart and heart racing. And we'll be supporting him with some medications called antipsychotics. Will that be fine with you?
Well, doctor, yes, yes.
Yeah, and some kind of talking therapy will be offered to him, and we can offer you some counseling sessions also, because I know that it must be a difficult time for you.
Okay, okay, doctor.
Right. Do you have any other concerns for me to be answered?
No, thank you.
Right. Thank you, Mrs. Brown, for speaking to me today. So today we have talked about your partner, Mr. Brown, and I have informed you that he is suffering from something called morbid jealousy. And he poses significant threat to you and to the neighbors. So we need to keep him in the hospital and manage him holistically. And we'll also provide you with social support, because he is the loan funder for your finances.
Okay, thank you. Time. How do you feel
Thank
about
you.
what you did?
Maybe I was speaking a bit fast and a bit formulaic I was.
It was a very good introduction, by the way. But I like, but pay attention to these subtle mistakes. Now, when you started to explain, it was a big chunk. You did not check whether I understood what you said or no, and you merged your explanation with the need for admission. So I expected from you, when you started to explain the morbid jealousy, that it is type of psychiatric disorder. It's considered to be a delusion because he has a false fixed belief without any evidence, and he can be risky. Did what I said make sense for you? Okay. Must make sure that you chunk and check when you do the explanation. Then you do a formulation, which I didn't feel that you did the information, by the way. Now, in this stage, there are two issues which you should address. That this lady might need support because when he is admitted, there can be financial problems, and there is risk from this man. So when this lady is going to, she said that I want to see him. So you can say that will be organized visits under supervision. This is how you say it. And it's very important to say that when he's going to be discharged, this will be according to our risk assessment. And the risk assessment is going to be an ongoing process, even after discharge, by a nurse who's going to follow him up to make sure that there are no concerns about his safety or your safety or anyone's safety, and that he is taking his treatment. And we might use a community treatment order to make sure that he is not going to stop the medications. Okay. As I told you that this patient is also taking cannabis, you must talk about the possibility of seeking the support of alcohol and substance misuse service. Okay.
Did you say community treatment order?
Did you say it?
No, I didn't say.
Yeah,
Is it what? Okay.
Very important,
Okay,
doctor, to mention in this station that this patient needs a community treatment order. When he goes out, he is not going to go out except after gradual leaves under supervision, and we will make sure that this leave is going to be safe. And then after final discharge, this patient is going to be followed up by a nurse for ongoing assessment, particularly the risk assessment. Okay.
Yeah.
very important to say not all the countries are going to say this. It's all about the risk. So when you do your management, you must focus on the risk. Okay, it's all about the risk in this station. So you do not ignore the risk. So when this lady is going to visit him, it must be a supervised visit because of the risk. And when he's going to be discharged, the discharge is going to be after frequent supervised leaves. And if there is no or low risk, he can be discharged. And after discharge, there will be a nurse who's going to follow him up to assess his mental state and that he's taking his medications, and also to make a risk assessment to make sure that there is no any concerns about safety. Okay,
And
let's see
how
the
to
feedback.
address
What?
how to address the concerns that she was raising regarding the finances?
Yeah, this is the social services. You must talk that you can talk. This is something which can be addressed by the social services. Okay.
Right. Okay.
So we need to tweak management of this. Let's see. You should say delusional jealousy. Okay, so a delusional, yes, you can say delusional disorder. So you have a lot of fans. So let's see according to our slides. What did you do? So let's see. You had a very good introduction. I liked it actually, and you gathered information whether he has any underlying physical problems. You know, so far, and I like that you started. What do you know so far about his condition? A perfect start. Let her speak. This shows that you have collaborative approach. You did not stop by lecturing and telling her why you know so, I know so and so and so. Very good. And then you made it clear that you were keen to know the level of risk and so on. Well, just focus on the explanation of the diagnosis. Now I want to hear from you with the formulation, please, according to our template.
Mr. Brown is suffering from something called morbid jealousy, and he poses significant risk to you and to the neighbor. And he had similar episode in past where he stabbed his girlfriend. And it seems to me that you have poor social support, and you need support in the financial areas also. So since he poses serious threat to you and to the neighbor, we need to keep him in the hospital and manage him further.
No, doctor, you are now talking about the management. Now we want to know what is the background. He doesn't have any underlying physical problems. However, there is history of substance use. Okay.
Yeah.
There is past history of similar episode of attack of morbid jealousy in which there was a need for admission and there was risk of violence against the partner. And there are some sorts of social support which is needed for the patient's family. This is how you do the formulation. It is not 100% academic, but something to make sure that you are going to score for yourself the point of formulation. Make sure. And do not make it a word salad in between the words and you think that the examiner will pay attention. Just signpost. I would like to highlight the most important points in our discussion and then talk about the formulation. Okay? When do you do the formulation? Immediately before talking about the management. Nobody's going to ask you and tell you, so tell me what is the formulation. This will not happen. Though there is a point for the formulation, but no one is going to ask you what is the formulation of this case. You are the one who's going to start talking about the formulation immediately before talking about the management, because as you can see, the formulation is the foundation of the management.
Okay. So in formulation, normally management does not come. That's what you mean to say, right?
The management will be simply the management. You are going to manage every point you mentioned in the formulation. Don't make it a salad. The management is something different from the formulation, but it is closely related to it. Okay.
So on foundation of formulation, we are going to manage, right?
Okay. Yes.
Okay. Thank you.
For example, here you mentioned that there is high risk, and this man is heavy, so high risk. He needs to be admitted. having morbid jealousy. This means that he needs some sort of psychotropics and psychological support. You mentioned that he needs some sort of support in his family, so there's a place for the social services. You mentioned that he has a history of substance misuse. This means that you must liaise with the alcohol and substance misuse services. There is no background of physical problems, so you don't need the physical intervention. Okay, so everything you mentioned in your formulation is going to be managed. So what if you just go through the management plan? So the question, what are you going to manage? This is when you talk about the manager, you must say exactly what are you going to manage, and then talk about the management. This is the idea which the candidates must understand. Okay, did you get it, Dr. Santosh?
Yeah, thank you.
Where the patient is going to be treated, you mentioned that he's going to be treated in a hospital. The investigations, did you mention the heart tracing and everything?
Yeah.
Okay, very good. Multidisciplinary team, everything, but pay attention to the, I know that it is not written in your notes, but it's very important to make sure that this patient is going to not to pose any risk after discharge. How to make sure that this is not going to happen. The discharge is going to be planned. In the beginning, there will be organized and planned leaves. And when there is a low risk, and we are sure that discharge will be safe for him and everyone else, he's going to be discharged, and he will be followed up by a nurse to make sure that he's going to take his medications. And still, the nurse is going to be ongoing risk assessment, and also a community treatment order is going to be set to make sure that he's going to take the medications. Okay. Very important to say this. You will not find this, unfortunately, in the notes. Let's see the worksheet. If anyone has any question, please write it down. If he does not take, one of our colleagues says that if he does not take his oral medications, we might resort to the yes, very accurate. He must. It will be very good to say this also.
Right. Someone said that we should mention delusional jealousy and not morbid jealousy. What is your take?
Well, actually, delusional disorder has many names according to the underlying delusion. But so
Right.
morbid jealousy is a delusional disorder which is related to very emotional relation between the two. So you can say that morbid jealousy is a delusional disorder. That's it. Okay, so formulated. I think you did formulate, but make sure that your formulation can be better. You recognize the significance of aspects, and the number 1 and 2 are going to be scored for you. Adequate management plan. Now, I don't think that this can be scored for you, though you mentioned medications, because you did not focus on the risk. Okay, your management for the risk could have been better. Okay, so 0.3 and 5 might not be scored for you, as well as 0.6, because as I told you, there are a lot of things which can be done for these patients after discharge. So though everyone feels that you did well, but if you understand that the core of the treatment here is the problem of risk, 0.3, 0.5, and 6 might not be scored for you. Again, I'm not an examiner, but I'm telling you what is the problem in your performance. It was organized. It was not formalic. Everything in your communication was good, by the way. I have no problem with your communication, but the problem is that in this particular case, focus on in your management on the risk. Okay, thank you so much.
Thank you.
Very clever. Thank you so much. Okay, who would like to go next? We had 8 stations, and only 4 candidates.
Hello?
Yes. Dr. Zaid, how are you, doctor?
Yeah, I'm good, sir. How are you doing, sir?
Yes. What is your station, doctor?
My station is about a bipolar affective disorder who was admitted in PICU for the last 3 days. And the nurse want to discuss about it.
Yes, the nurse who is not happy with the olanzapine, and she wants you to start him on lithium, isn't it?
Oh, yeah, exactly.
Yeah. So again, doctors, As I told you, the task is about your communication skills. Now you are going to talk with a nurse who, usually the nurse which you are going to have meet in the task, usually they are not happy, and they are going to put you in some sort of dilemma and stress because of the situation which they are going to raise. So in this situation, we want to change the medication because the patient is not improved on olanzapine, and the consultant said that they can give him lithium, isn't it?
Yeah, this.
So do not ignore what the nurse is saying and tell her more. So I feel that you are you are not happy with the management so far. Tell me why. And ask her if he has taken any other medications and if he has already been on this medication for enough period, and discuss the management plan with her. Do not ignore what she's saying, because if you ignore what she's saying, they are instructed not to be cooperative with you, and you will lose the station. You will lose the station. Don't do this, okay? So now simply this station, the nurse does not understand that there are the stepwise approach for in the management of the patient, and there are other alternatives other than changing the medication. For example, that this patient should be on the medication not less than 6 weeks at least before saying that this medication is not suitable. Number two, that you can use benzodiazepines. Number three, the duration is small. Number four, he is not taking the maximum dose so far. Okay. So let's start. 1, 2, 3, go.
Hello, Amanda. I am Dr. Ahmed, one of the doctor on call, and
Hello.
I got a call that you have some concern about one of the patient with you. Can you please share your concerns?
Yes, he is Jordan, doctor, and I feel that Jordan now is not doing fine on this medication, which this consultant started giving him it, and actually he mentioned that if there is no improvement, we can consider another medication called lithium, and I hope that we start lithium because this patient is totally not cooperative. He is not taking the medication. He is he is harassing the other patients, and a lot of problems because of him.
I think it's you are going to a difficult time over there. But can you please tell me, like, what exactly the diagnosis for Jordan is there?
Well, he is having, the nurse said that he have bipolar mood disorder, and he said that he is going to take olanzapine, and if there is no improvement, we can start him on another medication called lithium, and I hope that we start him on this other medication.
I appreciate your concerns. Can you please tell me more about, like, for how long this patient is over there with you?
Well, he has been admitted 3 days ago.
Good. So, what I understood from you that this Jordan is a patient of bipolar affective disorder, and he is started on olanzapine from the last 3 days, and he is causing a distress or causing disturbance to the other patients over there. Am I right?
Yes, yes.
Okay. Before and I appreciate that you have a concern that he should be started on lithium.
Yes.
Okay. I appreciated your concern for this patient. Can you, before coming to address this concern, I need to ask a few things regarding that. Is the patient, since last 3 days, his physical examination has been done?
Yes, yes, everything is okay regarding this physical.
Okay, that's wonderful. And this is any blood investigation in the form of
No, he's
complete
not
blood count?
cooperative. He is
Okay.
not cooperative with us.
And can you share what exactly the reason that he's not cooperative regarding that?
Well, he is not cooperative. He's shouting, moving. He is not allowing us to take blood tests, and that's why I feel that he should change the medications.
Yeah. And one last question I need to ask is: do you have any medical illness in the past?
No, we don't know so far, actually.
Okay, we don't know so far. So, Amanda, that's you are having a very genuine concerns. So, what I understood that still the patient has been started on olanzapine on the last 3 days, and he is a case of bipolar affective disorder.
He
And
took
what is your
olanzapine for 2 days. 2 days.
for 2 days? I appreciated that you corrected me. And what is your expectation, like how these medications some takes times? Do you have any awareness about that?
No, actually, the medications are mentioned by the consultant. He said that the second option will be lithium.
Okay. So I just want to bring to your information that the patient has been just started on olanzapine from the last 2 days, and what dose exactly is he?
He's taking 10 milligram.
Okay, so so it is the patient has been just started on the olanzapine, one of the medication used for bipolar affective disorder, and the patient need to be given this medication for a reasonable period of time, it's like 2 to 3 weeks, before this can be said that the patient is responding to that medication or not. Are you there with me?
Yes.
And and I appreciate that meanwhile the patient is causing disturbance to the other staff, causing risk to others. This might result in escalation of risk to himself. So meanwhile, we need to look for the other alternative measures to manage this behavior.
But why don't you consider giving lithium just to help him to be better?
Oh, that's a very important question. The patient has just started. The patient is with us from the last 2 days? Number one, patient, though no physical illness is there, the patient need to be done some baseline investigation in the form of complete blood count, renal function, kidney function, ECG, thyroid. And another important thing that before considering even the olanzapine what we are providing, according to the national guidelines, this is one of the important molecules. And once we can have a good trial for a maximum dose with a good duration, then we can consider about lithium. But currently, with his background, this is an important step currently.
So
Do you have any other concerns?
what can be the best route of action now?
Well, seeing his current behavior and the current diagnosis, I appreciate that first I prefer to have his complete physical examination. We'll plan the investigation as I told you, and I prefer to see him myself regarding that. And along with that, I will ensure that I will talk to the patient myself. Will see his concerns of regarding this medication, why he is reluctant, and what is he is there. Are you there with me so far?
Yes.
And along with that, I'll suggest that the patient should be given will be given more close monitoring.
1 minute remaining.
The patient should be closely monitored, and he can be uh, given medications like benzodiazepines along with ongoing olanzapine so that his behavior can be managed. And other non-pharmacological measures in terms of de-escalation can also be used whenever patient tries to go and disturb other people. Are you there with me so far?
Yes.
So this is the plan currently. I'll suggest that lithium is not exactly the current choice, but we'll be slowly escalating the olanzapine as the duration of time, and we'll see how the patient is doing so far.
But he's not cooperative though.
If the patient is not cooperative, as I said, the patient can be de-escalated, and the other molecules in the form of the de-escalation can also be used. And if it still does not cooperate, molecules like benzodiazepine in the injectable form can be used, which also can help in taking the samples and taking a blood sample as well as de-escalating him. Are you there with me so far?
Time, very good. How do you feel about what you did?
I think I struggle with the structure.
The Candice can give us a feedback. It was good, but please, I want you to formulate. Please formulate.
this our current patient currently in manic state, and
Pay
he's
attention to the feedback. One of your colleagues said that you are using patient. Whenever you talk about your patient, call him by his name. His name is Jordan. Say Jordan.
okay. Yeah, thank you.
Okay, yeah. Thank you.
So Jordan is a patient is a bipolar affective disorder, and currently he's causing risk to the other patients in the ward, and he's not cooperating with the treatment, and currently admitted in PIC.
Very good. All this in the background that we need to know more about his physical condition and past psychiatric condition, and also his social circumstances. Okay, very important to do the this formulation, because as we can see, the first point to this portfolio information. Now, let's see the feedback. Very clear. Yes, it was very good. Pay attention that you use the patient too much. Use the name of the patient, like what Dr. Ala is saying. Chunking and checking everything. So you need to stop and ask understanding. Yeah, maybe you should say delusion. No, this is the post. One of the colleagues saying that if they are able to finish the scheme, Dr. Patra, it is challenging. Yes, it is not that easy to finish the management in 7 minutes. That's why we have a particular plan to address all the points which should be covered in a management plan in 7 minutes. Okay, it is not that easy. Okay, it needs practice. That's why we are focusing. We have been doing this. Maybe this is the 4th session in management plan. 32 stations done so far to make sure that all the candidates understand how to do it. It is challenging. It is one of the most difficult tasks in the course. And unfortunately, the results in the management plan and management task is not that good. Okay, let's see. Well, now gathering the relevant information in the beginning, when I said that I'm not happy with the medications, well, you can see I understand you can tell me more. Why do you say this? Well, I mentioned olanzapine. Is he taking olanzapine? I should have asked this. So is he taking the medication so far? Okay, you should say this. I didn't hear it from the patient is not even cooperative in taking the medications. So this level of non-compliance is not suitable for someone to take lithium. Lithium needs a sort of compliance and cooperativity, because the patient should take his medications regularly. He should do investigations regularly. And if the patient is not cooperative, definitely lithium is not the best option. And moreover, we don't know the basic basal physical condition for the patient. So you should just ask him. So tell me more. Well, why do you feel that lithium is better? Is he taking olanzapine? And then signposts. So in order to address your concern, I would like to ask you some questions about the patient to have a better idea. So what do you know so far about his physical condition? You told me that he is been admitted 2 days ago. What are the reasons of admission? Is he admitted under Mental Health Act? Any idea about his past psychiatric disorders, and what are the medications which he used before, which helped him take biopsychosocial information and address the level of risk? And then there is no place to explain the diagnosis here. He is already diagnosed. But here there's a place to explain why lithium is not the best option. So there is no place to explain the diagnosis, but you should explain why lithium is not the best option, which you did very well. Formulation, you did not formulate. Your management plan, you said that you are going to see him, where the patient is going to be treated in the hospital, de-escalation, in a place away from the patients until it is safe for him to go with other patients, and there is low level of risk. You talked about the investigations, didn't you? Did you?
Yeah, I talked about the investigations.
Okay, and then the multidisciplinary team. Now, the medications, the best option is to use benzodiazepine to calm the patient down and increase the dose of olanzapine. And if still there is no improvement, you can add another mood stabilizer, okay? And you must mention that you are going to have a look at his past psychiatric file, if there is a file, to understand more about what are the medications which he used, which helped him. That's it. And then the non-pharmacological, you must talk about the social support and the place of community treatment order if the patient is not cooperative with the medications. Okay. Now, remember the community treatment order and following up at home to make sure that the patient is taking his. Okay, sorry, sorry for the interruption. Okay. Okay, so let's see the mark sheet. Mark sheet. No, so you, I didn't hear the formulation actually, so I don't think that this point is going to be scored for you. You recognize the significance of findings and results. Your management plan was good. You said that you're going to talk with your patient, so this is going to be scored for you. A risk, I think you talked about the risk. You identified the appropriate psychological and social interventions. Everything was good in your. So you did well. My advice: just pay attention to the formulation, as I said. It was organized, not as you think. I felt that it was organized, and other communication skills were good. Thank you so much. Okay, who would like to go next?
I can go next.
Yep. Okay, Dr. Sheena.
Yes.
So,
Okay, it's okay. If someone else wants to do it, that's fine.
I don't
it's
know
very
who one.
Yeah, you want to do it? Okay, fine. I'll just observe then and then I can go after you.
okay, that's fine.
Okay, who is you, Dr. M? Okay, what is your name, Doctor?
Mariam.
Dr. Mariam?
Yes.
Yes, so what is your station, doctor?
It's metabolic syndrome.
Excuse me? What?
Metabolic syndrome.
Yeah, metabolic syndrome.
Yeah.
Metabolic. Okay. Let's start. One. You must be ready with a simple and a good explanation of the metabolic syndrome. It's very important. Okay, here. 1, 2, 3. Go.
Right.
1, 2, 3. Go.
Hello, my name is Dr. Mariam, one of the doctors from mental health team. How I can address you?
You can call me Patrick.
Okay, Patrick, thanks for coming here today, Patrick. I understand that you got some blood done with your GP. So I'm here to explain more about blood results.
Well, I'm
So
a bit
your-
worried, doctor. This is the first time I do these regular checkups and someone says to me that I must talk with a doctor to discuss the results. What's going on?
Yeah, so your concerns are quite valid. But what happened is that all of your blood results are fine, but your blood sugars and your blood cholesterol, that is amount of fat in your blood, is a bit higher than normal this time.
I see, I see. Anything
Yeah.
else which is significant in my blood tests?
Not really. Other than that, every other all of the blood tests are within normal range, so that's reassuring. But we also measured your blood pressure and your weight in the clinic, and that is also in a higher range.
I see, doctor. So what can be the reason for this?
So that's a very good question. But I need to ask you for a few questions before I can give you the answer for this.
Yeah.
Given the fact that you have high blood pressure, high weight, and high cholesterol and blood sugar, so it looks like you are suffering from a condition called metabolic syndrome.
What is this metabolic syndrome?
Yeah, so metabolic syndrome, it is a physical health condition. It is a combination of these 4 factors that includes high blood cholesterol, high blood sugars, along with that high blood pressure and weight gain. Now, as you already asked, there could be many reasons for it. So I just need to ask a few questions if that's all right with you.
Yeah, no problem.
Do you have any other physical health problems, Mr. Patrick, for which you're taking any medications?
Not as far as I know, though.
I mean, high blood pressure, high blood sugar.
No, the first time to know from you that I have blood pressure and high blood sugar level.
Okay, right. And any other heart diseases?
No, no,
Stroke?
no.
Okay. And any of these diseases in your family by any chance?
Yeah, my father died from heart attack. Yeah.
Oh, I'm sorry to hear that. Along with that, Mr. Patrick, do you smoke by any chance?
Yeah, I smoke maybe 1 packet of cigarette every day.
Right. And do you drink alcohol?
Well, I drink beer regularly. Whenever I eat, I drink maybe 4 to 6 cans of beer every day.
Oh, right. And along with that, is there any pattern of diet that you're following, Mr. Patrick, at the moment?
Well, not the very healthy pattern of diet. No, I'm a computer technician. I just sit and eat whatever is available as fast food.
So you mean to say that you're in a job in which you don't move around a lot?
Yeah.
Okay. And along with that, is there any exercise routine that you have at the moment?
No. I'm not involved in this.
So, Mr. Patrick, I understand that you have a diagnosis of paranoid schizophrenia for which you are on clozapine. How are you doing on it?
Well, it is a very good medication, actually. It changed my life in a marvelous way.
So that's good to know. I understand that you're doing well in mental health, but by any chance, did you ever had any thoughts of harming yourself at any chance lately?
No.
Any thoughts of harming anybody else?
No.
Okay, so just to recap, Mr. Patrick, it looks like you are currently having a condition called metabolic syndrome on the background that you have a paranoid schizophrenia and you're on clozapine. Also, the deranged physical health parameters and sedentary lifestyle, which are the risk factors for it, and you're smoking and taking alcohol. So I would like you to tell how we can manage it further, if you're all right.
Yeah, no problem.
So, Mr. Patrick, we work as a team. So we will follow a holistic approach. By that, I mean, I will involve different team members in your management. So in the first place, for your high blood pressure and high blood sugars, I will refer you to your GP and he will monitor it closely. But if it's still high, he can give you some medication for it.
Okay.
And he will also give you some medication for your high blood cholesterol levels. With these medications are called statins.
Okay, doctor, no problem.
Does that make any sense so far?
Yeah. It sounds very helpful. Yes.
Yeah, and along with that, for your diet and exercise, our dietitian and physiotherapist can see you and can give you advice about your, your diet and your exercise that suits you according to your life today.
Okay, this sounds helpful. Yes.
Yeah, and along with that, it's also very important that you're drinking quite a lot at the moment, and you're smoking as well. So that also need to be cut down because it can impact your mental health as well as your physical health.
Okay, doctor.
Yeah, so there could be some counseling for your that can help you to cut down your smoking. But here, one important factor that I need to mention is smoking can also impact the clozapine levels. So you need to, if you're planning to cut it down, you need to do with the advice of a doctor.
1 minute remaining.
Along with that, this is the first step of management, Mr. Patrick. But in case it doesn't work, we do have other options as well. Would you like to hear them?
What did you say? Again, what is the last sentence?
These are the first step of the management of your condition. But if it doesn't work, we have other options as well.
What are the other options?
So we can add other medication on top of this medication that can help to minimize the side effects that you're already having.
Well, I don't want to stop this medication.
No, I'm not stop. We are not planning to stop it, but we can add a medication on top of it.
What is this
So that-
medication?
It could be an antipsychotic like aripiprazole,
I see. I see.
or if you or we have other options like metformin. So what they will do is that they will minimize the side effect of clozapine, and they will help you to reduce the weight as well.
Okay, very clear. Okay,
In-
thank you so
in
much.
case it
Time.
doesn't work- Thank you.
How do you feel about what you did?
It was fine. I just
It
didn't.
was good. It was very good.
Finish it.
It was very good. I like it. I was just acting as a opinion. Well done. Very good. Well done. Actually, I like it. I have no comment except that when you talk about the medications, talk about the possibility of adding aripiprazole in the beginning, not in the end. So he's already on a dose of clozapine, which is considered to be the therapeutic dose for him, and you should not change it. But the other option is to add aripiprazole, which is documented according to the guidelines, can correct the metabolic syndrome caused by this patient, caused by medication.
Right.
Have you ever been to the class before?
Yes, I lost MSc station, but I passed our management and history station.
It's very clever. You did it very well. I don't have any feedback. Actually, let us see. Let us see, mashallah. Let us see the slide. So you gathered enough information about it was very good about my physical, psychological level of risk and my social life, which includes the bad habits. And you checked the risk and you explained the diagnosis and you did your formulation. And that you set your management plan and you talked about the investigations. Everything was good, actually. I don't have any comment. And if anyone of the candidates have any comment, please. Everyone is saying well done. So pay attention. These candidates are experienced psychiatrists. No one reached this level in his career without being good in what he's doing. And when he says well done, this means well done.
Yeah,
Very
just need to be careful about MSCs because I just
very
had
clever.
gap of
No,
1%.
it was very good. It was very good. It was very
Thank you.
good. I like it. Let us see according to the mark sheet. So you did formulate, you recognize the significance of finding as a result. Your management plan was good. You were keen to ask me what is your opinion. So definitely 0.4 is going to be scored for you. You ask about the management. See doctors, even in this station, which is a metabolic syndrome, there is a 0.4 the risk. Always show the examiner that you are a safe practitioner and you ask about the risk, any concerns about your safety, which Dr. Mariam did. You did identify the psychological and social interventions, and your communication was good. MashaAllah. MashaAllah. Well done, doctor. Thank you so much.
Thank you.
Okay, who would like to go? I think Dr. Sheena's turn.
Yes, Doctor.
Yes. How are you, Dr. Sheena? I think this is the first
Good.
time for you to be with us.
Yes, it's the
So
first time.
So what is your station, Doctor?
Lewy body dementia management.
Lewy body. This is a difficult station, actually, because you need to talk about many things. Now, this man in this station started to develop hallucinations, and this is because he has increased the dose of levodopa.
Yes.
Okay, so it is very important to pick it up. And when you ask about if he has, in the beginning, if he is taking any medications, he will say to you that he's taking levodopa, any change in the dose. It's very common for this patient to have side effects from the medications which they are taking. And your management must include not only liaising with the, very important to say that I'm going to liaise with the neurologist. You are going to adjust the dose of rivastigmine. The possibility for him to be admitted is there after the social carer assessment. Okay, social services for carer assessment.
Right.
You must talk about the occupational therapist. Very important, and you must talk about a possible either he's going to be followed up in the clinic with a care package to make sure that he's taking his medications and all his needs are met, or he's going to be admitted in a nursing home. So very important to mention this. Okay.
Okay, I'm gonna try.
It's
I'm
not,
not sure.
it's not that easy, but when you know understand the concept, everything.
Yes,
It,
yes.
well, okay, still everyone is praising Mariam's performance. Okay, we are going to start a new station, so focus on Dr. Sheena, please. 1, 2, 3. Let's say that my name is Miss Brown. My name is Robin, and the man's name is Mr. Green. Okay, 1, 2, 3, go.
Okay. Hello, is it Mr. Robin?
Yes.
Yeah, hi, I'm Dr. Shah. I'm one of the psychiatrists from the mental health unit here. And I'm here because I believe you have some concerns regarding your grandfather, I believe.
Yes, my grandfather starting to hallucinate. He's talking to my grandmother who has passed away 10 years ago.
I
And I
see.
don't know what's going on. He keeps talking with her and as if there's something going on with him around which we don't see or hear.
I see.
And I want to know what's going on.
I understand. And I understand how confusing that must be for you. If you could give me an idea about what your understanding of his current situation is.
Well, doctor, we know that now he is diagnosed with Lewy body dementia. He has been diagnosed with Parkinson's disease, but the diagnosis has changed and he's taking rivastigmine from your side and also another medication from the neurologist. I guess its name is levodopa. And that's it.
Right. Also, I would like to, before I touch on the topic of what this problem is, I also would like to know what your concerns are about the risks he might have for himself.
Well, doctor, yesterday he was just walking aimlessly and he left the house and the police brought him back. And every day he just walks around at home, just talking to himself and talking to things which are not there.
I see. Okay. And this must be quite a difficult time for you and your family. Yes. So one can understand the problem if one understands how the problem affects a person. And I would like to explain a bit to you as simply as possible. So Lewy body dementia is a brain disorder, particularly affecting older people and males more than females. It's the third most common type of dementia.
Yeah.
So are you with me so far?
Yes, yes.
Okay. So what happens is that there are these protein deposits in brain cells, which are called Lewy bodies, and hence the name. What they do is they interfere with the way chemicals react with each other and the way they react with the brain. What you see is behavioral issues that you can see in your grandfather. You can see memory problems. You can see that he might be alert at one moment and not at the next, and movement issues. He might develop stiffness.
Yeah, but he's hallucinating now. I don't know why he's hallucinating.
Yes, so hallucinations can be a part of this problem, but as I understand from my notes, he, and you also mentioned that he's already on levodopa, that his neurologist. So we will need to speak with the neurologist to understand what dose he's on. And to make you understand this a little well is levodopa, if given in more than the required quantity, may cause visual hallucinations in a patient like that. Plus the disease itself causes visual hallucinations. Levodopa does help in the movement issues, what we call as Parkinsonian symptoms. So we need to adjust to that accordingly, and we will be speaking with the neurologist in doing that.
I see. No.
Am I making sense?
Yeah, so what can be the best route now in order to help them?
So I understand that, just to recap, the situation is that you are worried about his visual hallucinations and the risks that he might be facing at the current time. And from my notes, I understand that this problem has been going on for 9 months, starting with his Parkinsonian symptoms, the movement issues, and then proceeding to visual hallucinations, and then proceeding to memory as well. And I need to inform you at this point that I will myself need to assess the patient. I will need to see the patient, speak with him, and also check his physical symptoms as well as his psychological symptoms. My recommendations for you right now, if you're ready to hear that, I have a management plan. If you're
okay, no problem. Okay.
Okay. You are a very important part of the management plan, as are his near and dears. The other side of the management is what we will handle, the medication parts. So firstly, after speaking to the neurologist, we are going to adjust his dose for levodopa that he's already on. That should take care of his Parkinson's symptoms and perhaps decrease his hallucinations. Secondly, he's on rivastigmine already. We are going to review the dose for that also and keep checking his memory and his alertness and if it's helping with the hallucinations.
Doctor, I don't want to interrupt you, but I've read that you can give some medications for hallucinations, a group of medication called antipsychotics. So
Yes.
don't you think that this can be applied, can be given to him?
So there is a reason why I didn't keep that as first line for you in explaining it to you, because this is not the best medication we can give him. We can give it to him in lower doses, but perhaps not the best thing, because he already had a problem with an antipsychotic, haloperidol, that his GP gave him, the stiffness of limbs. So if need be, we can give him an antipsychotic called quetiapine in small amounts, and we'll see how that helps. So that is the medication part of it. Secondly, we would also like to help him, his person, by certain things that he probably would enjoy. Any kind of music that he would have enjoyed, or movies, or maybe art.
One minute remaining.
That is one. And thirdly, we would like to involve you, get you on board with the social care. So I understand that you already have carers coming for him. So we would like to suggest social services for care assessment, if he's being taken care of and always possible. And secondly, we would also like to suggest a care package that we can provide to him and see if he's manageable at home or in a nursing home. We'll have to discuss it with you as well as the rest of his family, and including the patient. And more importantly, an occupational therapist who will modify his environment and decrease the risk of falls or any other injuries that he might face.
Okay.
Does that address your concerns?
Okay, thank you so much, time. How do you feel about what you
For
did?
talking to me.
Okay,
Thank you
give
for
me your
talking.
feedback. Okay, give me your feedback. And I hope that they can just also give you feedback and pay attention to what they are saying, very important.
I'm sorry, I didn't actually. I was just looking at you.
No, just after finishing, pay attention to what they are going to say. So
Yes,
what is your
yes.
feedback? But give me your, how do you feel? I'm talking now. Later
Oh, sorry,
on.
I'm so sorry. I was reading the chat. Okay.
No,
So
later on, have a look at what they are saying. Very important. We are all
okay.
good psychiatrists. So what is your feedback about what you did?
I think it could have been better. Like I have a lot
Why?
of thoughts in my head, just to, I knew I was supposed to do this, but it's just a lot of thoughts coming together. Need to be clearer, shorter, crisper, and maybe not confuse the listener.
Okay, very good. So please pay attention when you don't say any inaccurate information. Antipsychotic are not recommended for this patient, not because he took haloperidol and developed stiffness. Anyone can develop extrapyramidal side effects, and still haloperidol can be given to him. But in this particular case, Lewy body dementia, they are very sensitive to the side effects of the antipsychotics. That's why the antipsychotics is not the first line in the management of their hallucinations or mental disorders. And if there is a need, quetiapine can be given, small dose for short duration. Quetiapine should be given small dose for short duration, which you mentioned only quetiapine, not. So are you going to give him a full dose? This is definitely not the case. And when you said that you are not going to give him, you said that you are not going to give haloperidol because of history of extrapyramidal side effects. No, this is not right. He is not a candidate for antipsychotics because he has Lewy body dementia. Okay, so let's see according to our worksheet. Let's see the feedback. I think Shock and check yet. I felt in the middle, Dr. Luqman, it's accurate. You should, I felt that you're lecturing to some extent. Pay attention, make it, doctor, a dialogue, not a lecture.
Right, right.
Please make a dialogue.
Got it.
Excellently, okay. Remember the patient's name is also important. Okay, very good. So let's see, according to our slides, always make something objective as a reference to yourself. Otherwise, you feel that, I feel personally that you did well, but I don't make this a reference. So in the beginning, you should gather relevant information, address his concern, tell me more about his physical condition. And please, doctor, so this, you must demonstrate that the hallucination is related, there is a temporal relation between the development of hallucinations and the change in levodopa,
Okay.
which is something which you did not do. So we came up with the conclusion that it is due to the medication. So why didn't you also, when did this happen? Was it after changing the dose of his medication, something like, so pay attention to this. So in the biopsychosocial domains, asking if he has any physical problems in medications, any change in the medications, okay. Psychologically, if he is hallucinating, any, well, socially, asking about the level of support which he's getting, because this type of patients need a lot of support.
Right.
Lewy body dementia is different from any other dementias. It needs a lot of support, okay. And when you ask him about this question, the story goes that there is no support. He's out for 9 hours to work, and as well as his wife, and this man is left alone. And the risk which you have addressed. Okay, so you should explain to him that this man is having Lewy body dementia. He developed. There is no place to explain again the Lewy body dementia, which you have done very well, but it was out of the task because this man is already diagnosed. And I'm not here to ask you about the diagnosis of this man, but I want to ask you about the problems which he's having now. So instead of explaining the diagnosis, you should have explained what happened to him. So this man has hallucinations, most probably due to the medications which he has changed, which is not uncommon to develop hallucinations because of it. And also this can be part of his symptoms as having, because he's having Lewy body dementia. And then do the formulation now. I want you to do formulation, please, according to our template. Just simply, what is the main psychological problem now? What is the level of risk? And the background, what are the information which you know or you need to know in his biopsychosocial domains. Okay, doctor, please, can you please formulate,
Yes. So the situation is that currently, I forgot the name of the patient. I'm sorry.
No problem, Mr. Green. Mr. Green is
Mr. Green, yes. So Mr. Green is currently facing visual hallucination, problems of visual hallucination, and that is very distressing to the to his grandson who's in front of me, and this also poses a risk to him. That's the current situation. Secondly, also, yes, on the background, he's already on medications. That's levodopa. He's on rivastigmine. We need to find out. When was the dose increased, whether it was increased, and whether the visual hallucination started after that.
Excellent.
Or increased after that, and need to assess the patient myself physically as well as psychologically.
This is later on too. This is the management also. We need to.
Okay.
Also, there is some sort of there's a need also to assess his level of social support around it.
Yes.
So because every word you are going to mention in the formulation means will be reflected in your management plan. I hope that now you understand what is the formulation. Okay.
Yes.
Now, according to our way of saying our management plan, so what are you going to do? Did you say that I'm going to see Mr. Green myself and explain to him, assess his physical and mental condition, and also assess the risk? Did you say this?
Yes.
Number 2, where he's going to be treated. It's not black and white, doctor, please. Now you have a patient who might be in need to be admitted in a nursing home, or he can be followed up in the clinic and at home by a treating team, a nurse, and so on. So you must say it clearly. According to our assessment, your grandfather can be treated at home if there is a low risk and also there is enough care given to him.
Okay.
However, if after care assessment there is a possibility for a need for admission, this would be the case. You must make sure that you address all this point. The investigations, very important to say the investigations. Did you talk about the investigations?
No, I didn't. I didn't. I had written it down, but I didn't mention it. Yes.
Very important, though. Multidisciplinary team. Here there is a place to liaise with the neurologist. You're going to see the patient yourself. You're going to change to adjust the dose of rivastigmine. Either he's going to be followed up in the memory clinic or he's going to be admitted and where you're going to see him. And there is a place for quetiapine if there is no improvement in the hallucinations. Now the social or the non-pharmacological, there will be a social services assessment for the carer, and there can be a care package which is going to be formulated by or tailored by the social services. There will be occupational therapist, and also there will be a nurse who's going to follow him up. And please, doctor, please don't forget in dementia, the possibility that this patient might forget his medications. So either he's going to use patches or Z boxes. And the nurse is going to make sure that he's going to take his medications.
Right.
So very important in the management plan in any dementia.
Right.
Z boxes, patches in case of rivastigmine, which is available in patches, or the nurse who's going to follow him up to make sure that he's going to take his medications. Okay?
Mm-hmm.
Very, 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 very important.
Right, right.
I know that this is not mentioned in some of your books, but we want to say things which will make us different from the other candidates to us. Okay.
True.
Let's see the mark sheet. Okay. So well, I don't know. You tried to formulate, so this might or might not be scored for you. You identify the significance of findings as a result. Your management plan. Now, I don't know, because you did not mention that the nurse and well, I don't know, this might or might not be scored for you. I don't like the candidates to put themselves in this situation or the point might or might not be scored according to the subjective evaluation of the okay. So you said that you are going to talk to the patient. This is going to be scored for you. The risk assessment plan. You said that you are going to. Did you talk about the risk and assess? Okay. Psychological and social. You mentioned it was organized, not formalic. Well, your communication skills are good, very good. Okay, but pay attention to the points which I've said in the management plan. Okay, very good.
Thank you.
You are clever, doctor. Very, very clever. Thank you so much. Okay, who would like to go next?
Can I?
Yes, Dr. Muhammad. How are you?
I'm fine, thank you, Dr.
So what is your station, doctor?
It's about patient in seclusion, dehydrated.
Yeah. Very, very, very interesting and very important station. So now pay attention to this, some points regarding this station, which you should pay attention to. Now, when you're going to have this station, you will find a very big mark, A4, two A4 papers, which I find, personally, I found it very difficult to finish twice in 4 minutes. Okay, so how, I don't know why did you, the story is simple, but they write very big chunk of talking, which is totally nonsense and can be considered to be irrelevant. The story goes that this is a resistant schizophrenia resistant patient. I think there is some sort of background noise. Okay. And he has been admitted under Mental Health Act. He has been taking clozapine. He is not cooperative. And he punched one of the nursing staff. And he is having a sort of delusion that they want to poison him. And that's why he is not eating or drinking. Okay. Did all everyone? Okay. And they were not able to do anything to him because he is not cooperative, except putting him in a seclusion room for 48 hours. And they are now asking you to help them in his management. This is all the story. This is all the story. This is going to be written in 2 big A4, which many candidates found, particularly those whose can. Particularly those who have, for English language is not the first language, okay? Particularly those whose English language is not the first language. They find it very difficult to finish these 2 big 2 A4 papers. Number 2, which is a very important technical problem, which I myself found it very difficult. I didn't pass this station because of this very strange problem. Now, in order to navigate between the papers in the online exam, in order to navigate between the papers in the online exam, you need to use the right and left buttons in your keyboard. A simple information which neither the invigilator knew, nor the role player, nor the consultant. And I was not able to see the other 3 A4 papers because there was another A4 paper which includes the patient fluid input and output chart. So when you open the candidate notes, in order to navigate between the papers, use the left and right buttons in the keyboard. Simple information which nobody knew, but I was not able to see the other A4 papers because of it. Okay. Now, pay attention to what is required from you in this station. You are required to pay attention that the nursing staff are so distressed because one of their colleagues has been punched in his face. So this requires from you to do the briefing in your assessment. Number 2, this patient is in seclusion for 48 hours, which is not the right thing. He must have a time out under supervision by 1-to-1 nursing staff or even 2-to-1. But putting him in the seclusion room more than this means that this can increase the agitation. Number 3, you must put a clear plan for the nursing staff to follow his physical condition according to the medical early warning score, which you can have a look at it in the Google it. A simple scoring system in which the vital data of the patient is put in one scoring system. And according to this score, you can detect whether the patient is having any early medical warning sign or not. Number 3, you must talk about the fluid chart which he is giving to you. So the fluid chart shows that there is slow or low fluid input and low fluid output because the patient is not drinking any water and definitely there is low urine output. And the patient, there is a big possibility that he might be dehydrated. If the patient is dehydrated and after assessment, a clinical assessment, and according to the investigations, he might need to have fluids. In the UK, they do not give fluids like us in the mental hospitals. The patient will be in need to be transferred to the medical side to take fluids. Don't say that we are going to give him fluids in our side. This is a mistake. Okay. The fluid is a physical decision, is a decision by the physician, and it should be given in the medical side.
Okay, and what will happen for section because he is under section?
Still, he will be under section. He will be under supervision, but we will be escorted by the nursing staff, and he will be given the fluids, and his medical condition will be corrected in the medical side. Okay.
Okay. Yeah.
Okay.
What is the name of the nurse and the patient?
Let's say that my name is Robin.
Robin.
And the patient's name is Michael.
Okay.
Okay, let's start. 1, 2, 3, go.
Hello, Robin. I'm Dr. Sami, one of psychiatrists working here. I understand that you have the condition of Mr. Michel.
Michael.
So, Mr. Michael, so please could you tell me how is his condition now?
No, well, he is in a very bad condition, doctor, and he really did a lot of problems since he has been admitted 2 days ago. And he is in seclusion for 48 hours now. Really, we require your support in the management of this patient.
Oh, I'm sorry to hear that. It seems a hard condition for the staff, and I understand that he punished one of our staff.
Yes, he punched one of our nursing staff in the face, and he took a leave because he felt that he cannot continue because he has a big bluish discoloration in his face because of this punch. He did an X-ray, everything is okay, but he needed some sort of leave.
Yeah, I hope she's okay now.
Yeah, she's fine.
And okay, regarding to Mr. Michael, can you tell me how is his vital signs?
He can hardly let us follow up his physical condition.
Oh. This is because I know he is suffer from condition schizophrenia, and unfortunately he relapsed because he did not adhere to his medication.
Well, we feel we don't know exactly why he has relapsed, but he has been admitted 2 days ago.
Okay, and I understand that now he is in the seclusion room.
Yes.
Okay. He was aggressive, yeah?
Yes, and he's still aggressive. He's not cooperative.
Okay. So can we do de-escalation technique for him?
We tried, doctor, to help him by de-escalation, but he is not cooperative. He tried to punch. He punched one of our nursing staff when he tried to talk with him, help him to understand that he needs to calm down.
Yeah. So I think in this situation we can give him a tranquilizer, rapid tranquilizer, to de-escalate him and decrease his aggression.
Okay, doctor.
And I wonder about if there is any electrolyte disturbance for Mr. Michael.
We didn't do any investigations. He didn't give us the chance to take blood.
So I think we will liaison with the medical team, as I'm afraid it may be emergency conditions that the patient may suffer from a condition called dehydration.
Why do you say that he is dehydrated?
Because from the flow chart, I see that the body intake and the body outside is increased than the body intake. So he is at a high risk of dehydration.
Okay, doctor. Okay.
Okay, and I wonder about if we can encourage him first for packaged or sealed fluid, if it is okay.
Well, he can hardly eat anything, doctor, from our side.
Okay, so my management plan, it will be first we will observe him as one-to-one observation, and
yes.
giving him a tranquilizer, and also we will get highly observed for what's called early warning sign scales.
What do you mean by the early warning sign scale?
Early warning sign scales, it will it's about a scale about if there is any warning conditions that lead to complicated later on,
I see, Doctor.
like
I
his
see.
vital signs, like if he is in need
But he's
for.
not cooperative, doctor, with us. He does not want to do anything, any investigation.
Yeah, I mean, after we de-escalate him and after he coming calm, I think we can deal with him.
I see, doctor. So, doctor, do you think that we can put him back on clozapine, which he has been using before? Because I've read that this is the only medication which helped.
Later on, after his condition is stabilized, we will discuss this with our consultant, because he's responsible for continue this medication for him. Are you follow me?
Yes, yeah.
Okay. Do you want to ask about anything? You want to ask
Anything
about
else you
anything?
feel might be important in his management?
Sorry?
Anything else which can be important in his management?
Yeah, I think we, as mentioned, we will do our blood investigations. Our if there is any electrolyte imbalance, we will correct it, and we will rehydrate him, even if he not cooperative with after the escalation technique, and after encourage him for sealed or packaged fluids. We can need IV fluid, unfortunately. And also regarding the medical team, it will be the last chance for us as deal with him under mental capacity.
Time, how do you feel about what you did?
I don't know, I said it's a chaos.
I know that we are كلنا عندنا. Okay. So pay attention. That when I said that that one of our colleagues has been punched in his face, I didn't feel that you were very empathetic. You just asked, so is it okay? So that must be a very difficult moment for all the nursing staff. And this means that in the management, you must put a debriefing. You know what is debriefing? You sit with your team to discuss what happened in order to make sure that this is not going to be repeated again. This is debriefing. Okay. Why did you say you are going to liaise? You say you are going to liaise with the medical team if there is need. Okay, you said that he is dehydrated. Who said you are not sure? Go do your physical assessment and your investigations, and after that, if there is dehydration, you are going to liaise with the physician to see how we can help him. If there is a need to give him fluids, we can arrange to transfer him to the medical side under the supervision. Okay, this is very important. Doctor. You said that we're going to liaise him doing this. Now, dehydration. Now, we didn't ask about the symptoms of dehydration at all. Asking about the symptom. In the beginning, we said that we are going to take some information from the nurse, and we take a handover, and we say clearly that we want to take a handover because this is what is expected from you to take a handover. Okay. You don't initiate clozapine by the permission of consultant. This man has been already diagnosed with resistant schizophrenia, and clozapine is prescribed for him. We don't do this. If he's already on a medication, we don't ask the consultant to reinstate the medication which he has been taking already. Nobody does this. Nobody at all.
I didn't see the scenario, unfortunately. Yeah. So I didn't know that he is taking clozapine or not.
He is resistant. I told you that he is resistant. And now, very important. Now, this man, there is always a place for social part of the treatment. Now, this man needs community treatment order to make sure that he's taking his medications. Very important. A nurse is going to follow him up, and the team is going to follow him up after being discharged to make sure that he's taking his medications and to detect as soon as possible any signs of relapse. Very important to mention this in your management plan, because there is, in the mark sheet, there is a point for the social support for this patient. Okay, let's see according to our screen mark sheet. Your introduction was good. In the beginning, you are talking with a nurse. Doctors, please, when you talk with a nurse, it is expected from you to take a handover. What do you mean by handover? You take the important information about the biopsychosocial domains of the patient and the level of risk, and check the management done so far. This is a nurse who knows physical and psychological, social information and risk information. Also did some management steps, which is very important for you to know, and this is what is expected from you. Okay, number two. Now, there is no place here to explain the diagnosis, but you should formulate, so please formulate them.
Resistant resistant. Mr. Michael has resistant schizophrenia. He is secluded due to aggression.
Now, this is management. So
high-
this man, there is high risk. No need just to say that. So this man is having this man is having a resistant schizophrenia. He is in relapse. There is high risk because of his mental condition. All this in the background that we need to know more about his physical condition, possible because of possibility of dehydration. We need to know more about his psychological condition. By the way, when you ask about the why do we need to know, there's a possibility that this man can be confused. So when you take information from the nurse about his psychological condition, not only you should ask about the possible hallucinations and delusions, because this man has delusions against the nursing staff that they are poisoning his food. That's why he's not eating. This is why you should ask about the psychological condition of the patient. And also you must consider that there is a possibility that this man can be confused. So ask him about any possible confusion, any disturbance in his sleep-wake cycle and level of attention and so on. So back to the formulation. In the background that we need to know more about his psychological condition, there's a possibility of confusion, and his social circumstances, we need to know more about them. All these points are going to be addressed in your management plan. So what are you going to do? You are going to see him yourself. I didn't hear from you that you are going to see him yourself. You are going to assess his physical and mental conditions and to assess the level of risk. Very important. Where the patient is going to be treated, he is going to be still in the seclusion room, but he should go out, because going out de-escalate his agitation, and it is not right to maintain the patient in the isolation room more than 48 hours. The investigations are the basic investigations, and please do not forget the urine drug screening, very important. It is not mentioned in the notes, but you should say it. You want to make sure that we are different from the other candidates to pass. Okay? There's a possibility that man might be using drugs, so we must do urine drug screening to make sure that this relapse is not related to his abuse of any substances. Now, the multidisciplinary management plan, your management plan, as we said, should include debriefing and the multidisciplinary team, the possibility of asking the support of the physician after your assessment because of the possibility of dehydration. Physically, he should be followed by the medical early warning score. Psychologically, he should take benzodiazepine to calm him down, and when his physical condition is stable, you can start him ideally on clozapine because he is considered to have resistant schizophrenia. However, if the compliance of the treatment on the medication or the patient on the medications is not guaranteed, a depot might be considered. Okay. Okay, do you hear me, doctor? Okay.
Yeah, sure, I hear you, Dr. Hassam. Yeah.
Okay, so regarding the social part of the treatment, the social part of the treatment here is that when he is discharged, you must make sure that he's taking his medications by a community treatment order. He's going to be followed up by a team. Some can just say that it is the crisis team. It's not important. Just say that there will be a team who's going to follow him up. And a nurse is going to follow him up to make sure that he's taking his medications and to early detect any signs of relapse, and also to do risk assessment. Very important to talk about the risk. So before going through the mark sheet, anyone has any questions? Let's see the transfer policy. Due to the patient medically unstable seclusion. Well, if Dr. Iman, if you are sure that he is medically unstable, you don't know. That's that easy. Okay, so let's see the mark sheet. Again, I'm repeating the mark sheet to help you to understand how you are scored, because this is the backbone which will make you pass. You just don't go and do your task without knowing how you are assessed. The first thing is that formulation, unfortunately, you did not formulate. You recognize the significance of findings. Your management plan was lacking many things, so this point is not going to be scored for you. You didn't say that I'm going to talk with the patient, so this point is also not going to be scored for you. The risk, did you talk about the risk management, that he's going to be staying in the seclusion room and so on? Did you say this? Okay, so does not identify appropriate and psychological and social intervention. Again, this point might not be scored for you. There are a lot to talk about in the social interventions which you did not mention. Psychologically, I felt that you are also lacking because you did not mention the need to start depot if the patient is not compliant on the medications. It was not very organized. Other than this, everything was okay. Thank you so much. Okay, so anyone has any questions before we end this session? Okay, doctors, thank you so much. So I think this will be our last management session. We can have another one, but on one condition: if we just new stations, difficult stations, not stations which we have done so far in the past list. If you are okay with that, send the new state management stations which you want to do. If you feel that this is enough and we can start the new task, which is the task taking history, just inform me on our group, okay? Well, what is wrong? Let's do the new management stations too. Well, if you just mention, dear doctors, there are 32 stations done so far. If there are other stations which you feel you want to do, because there are new stations, just send me these stations, okay? Cognitive behavioral station. This is an explanation of the this is an explanation, doctor, not a management. CBT. CBT stations is, Dr. Sabi, is an explanation, it is not management. Okay, so thank you so much. Please, doctor, this is not more than 50% of what you should do. What the next 50% is that you write down your own notes, and you should practice with your study partner. The exam is very soon, by the way. Okay. Have a good night. I wish to see all your names at the post list. Bye bye.